Well, a warm welcome to this update. We're looking at Brazil particularly today because Raphael has sent us an excellent report from the ground in Brazil, but we'll look at it in context of the Americas as well. So just to start off with some background, here we have the new confirmed COVID-19 cases per million. United States going down, Brazil has gone up. Well, United States going down and now sort of going up and levelling off. Brazil has been going up, but is just now starting to go down somewhat. And this reduction in Brazil does appear to be a genuine reduction. So that's good news. Now, comparing the two countries again, here we see the vaccination status, and we see that the United States is well ahead of Brazil. Now, as we'll hear in this report from Raphael, there's a lot of new variants in Brazil. He talks about the P1 and the P2 variants and probably quite a few others that are driving the transmission in Brazil and increasing cases. But we know there's a lot of variants in the States as well, like the B117. But the difference is in the United States, they've got much more vaccination, many more vaccinations done that are going to keep these new variants down, whereas Brazil, there's a risk that the new variants can outcompete the vaccinations. Now, that doesn't mean say the United States is out of the woods by any means. The new variants in the United States have caused this recent increase and could still cause more. So we're not relaxed about the United States, and still we're somewhat anxious, in fact. But in Brazil, although things are reasonably good at the moment and vaccinations are increasing, well, when I say reasonably good, I mean it's gone down from a peak of high conditions there. But the vaccines are increasing more slowly in Brazil, so more time needed till we get anything definitive on that, really, and in terms of the race between vaccinations and infections. Now, looking at the Americas in context now, so Venezuela, Bolivia at the bottom, then Ecuador. Canada is increasing, Colombia is increasing, the United States we've discussed, Paraguay next, then Argentina, then Brazil. Chile appears to be slightly worse off at the moment as well, and I haven't got it on, but Peru is kind of roundabout just above the United States level as well. So that's kind of a bit about the background to the South American situation. Now let's go on to Raphael's report. There's some good news, there's some unfortunate things that have happened, but anyway, I will leave it to Raphael, and thank you, Raphael, for an excellent report and in very good English as well, it has to be said.
Hello, Dr. Campbell. Hello, all your viewers. My name is Raphael. I'm from Brazil. Belo Horizonte is the city. It's the third biggest city in Brazil. Asked me to talk about the situation locally and in Brazil as a whole. In Brazil, we have this very high number of new cases and deaths, sadly, and several places reaching capacity in hospitals. And so far, apparently we go into a plateau. It's a very high plateau, actually, but we don't know exactly because the reports of the weekend maybe are just delayed because on the Friday we had a holiday, so that those numbers are still to be updated. So in my city, things are a little bit better. We went from below 1, the rate for infection was like 1.3, like 3 weeks ago or a month ago, and now it's below 1 for the first time in a while. And we reached capacity like 2 weeks ago. For a while, we reached 108%, I believe, which means there was a waiting list for the ICUs. And but I don't remember any reports. I believe 1 or 2 reports of people dying without assistance. But that's not the case for several other places in Brazil, like in the south, a city called Porto Alegre was really bad for almost a month, with a lot of people on the waiting list and a lot of people dying with the lack of hospitals care. So right now we are looking to keep the measures. We are trying to understand what is going on with variants. We know here in Belo Horizonte that we have the P2 variant as the main variant, but they don't. So far, at least, the reports are that the scientific data is that it's not more transmissible. It's just better fitness of in an individual that could that variant would replicate more easily. So after the transmission, so it's a matter of fitness of the virus of this specific variant. And in other places there are older variants. This P2 variant is from Rio, state of Rio de Janeiro, and in Manaus was P1, and we don't know exactly. In Manaus, for instance, there was two subvariants of that P1 variant, and they develop independently from one another, and so it's really hard to know if we are actually dealing with a new variant or even a newer variant. But so far, we're trying to do the social distancing measures. And here in Belo Horizonte, I believe we went for a better situation because we did the partial lockdowns and reopening and locking up again. So I believe I could infer that would be the part of the results, part of the success. Right now in the state, we have, in the state of Minas Gerais, as I said, it's the second biggest population. We have 20 million people, and we have 4,600 ICUs, and 3,900 are occupied right now. So we're still with some degree of possibility to get more people into ICUs. Well, I believe that's most of the situation here. We are trying to see after this what we can try to get from the learning process to adapt for another situation in the future. And about the vaccines, I forgot about that. We reached 21, 22 million people vaccinated with the first dose at least, and 6 million people, I believe, with the second dose. My father got vaccinated first dose in the beginning of March and got the second dose 10 days ago. And he's doing fine. He had a little bit of tiredness when he got the first one, and a little worse in the second one, but he's doing just fine right now. He's 81 years old. And my mother got vaccinated. She's a bit younger. She got vaccinated 10 days ago for the first dose. And I know from the family of my father, my uncles and aunts, they got vaccinated as well also. And my father had a brother, a twin brother, and he got vaccinated with a different vaccine. So it's like a micro experiment of two different vaccines in a very similar individual, to these very similar individuals. So, well, that's the situation right now. Oxygen was a problem in the beginning. We saw some reports of some specific places lacking oxygen, but not to the point to not having enough. But it's kind of like more a logistical problem than supply problem. And about the deaths, I talked about a little bit of the reports of deaths. In the federal health care level, they issued weekly report of the detailed cases. And those reports, you can see that the main problem is delay of the reports. I don't believe that Brazil is not counting any deaths. It looks to be like a very robust system to count the deaths. The problem is it's a lot more. It's a lot slower than we could feel adequate to do it. So when you saw the report, when detailed report of deaths from Brazil, you can see the data of the exactly day of the death and the day of the report, and sometimes it's like 2 or 3 months off. Like in the report of last week, we had deaths from last year, from November, December, being reported now, but there are not new deaths. So it's a little hard to understand, specifically in places like in Amazonas, where the capital is Manaus. And the state of Amazonas is huge. It's almost three times the size of France. And so it's very hard to report, but the reports eventually always gets counted. So I believe we have most of the cases and reports of deaths pretty accurate, but we don't do enough testing maybe. Oh, and this report, detailed report of federal level, we also have the number of tests that were RT-PCR and the antibody tests. And it's almost 50-50, so almost half of the reported new cases are actually antibody tests. So it's basically that people had COVID a while ago, so it's not a new case that will impact the healthcare system in the next few days. So I believe that's all. So thank you for all your work again, and wish you and all your viewers a good day. Hello, Dr. Campbell. Hello,
Raphael,
all
that
your
was
viewers.
an excellent report. Thank you very much. And it also makes sense of quite a few of the things where we've had incomplete news. I mean, mainstream media is saying that deaths aren't recorded in the Amazonian area, but Raphael clearly there believes in the robustness of his country's system. It is sad to see that some people have died through lack of resources, albeit in limited areas, but it sounds like the Brazilian medical authorities are getting things under control now with more oxygen and things. So no substitute for getting evidence from some well-informed, intelligent opinion on the ground. Now, Raphael did remember something else that he wanted to include, so let's just see what that is now.
Hi, Dr. Campbell. I forgot to talk about one specific thing about the ICUs here in Brazil. I was talking with a friend. She's a physician. She's a otolaryngologist. Hope that's okay with the pronunciation. And she was talking about the intubation process. That in Brazil, there's a lot of cases that people dying after the intubation. Of course, that basically because of the severity of the disease, but also because of the procedure on itself. So she's being requested since the beginning of the pandemic. She's not a ICU specialist, but she's a specialist in throat and throat-related, neck-related surgeries. So she was talking to me about how specific is this job and how important it is for the procedure to be really accurate. So I believe that some of the cases, not that many I believe, but some of the cases maybe are just a problem with the process of intubation, which is, it's common, but it can be tricky sometimes by what she told me. and she was the one that was helping me with my COVID case. I wasn't intubated, of course. I never went to the hospital, but she always told me that the procedure is very important for the treatment on itself. That's why I forgot to add that. So here's the new video. Thank you. Hi, Dr. Campbell.
Thanks,
I forgot
Raphael. I haven't heard anything specific about intubation difficulties during severe COVID-19. Interesting. I will ask intensive care colleagues about that. But interesting that you've noted that. And of course, I'm very pleased that you've recovered well from your own personal COVID. Excellent report, excellent English. Basically nothing to add to that. And it's just really good to get first-hand evidence from people in the country. Now let's just look at I think we can see Raphael's father, who we're very pleased has got his vaccine there. That's excellent. So that's great. So and glad that you're doing well. So that's good stuff. Now separate issues. This kind of amused me. That there's a board game. If I get the wrong bit here, there we go. There's a board game here called Pandemic. Now, I hadn't heard of this, but someone's obviously had the bright idea. And apparently, to keep the pandemic down, you have to cooperate. Presumably, you need international cooperation, and world bodies need to cooperate. So, probably some lessons to learn from that. So that's Rebecca sent that in. So thank you for that. Thank you for that, Rebecca. The board game Pandemic, fascinating. Right, just a few other pictures to show you. I think from India. Yes. So some fairly good news on the vaccination from India. So this is Susanna, and this is her nurse who gave her the vaccine. And that's good news. Now, Susanna actually went to a private hospital, and it cost £2.45. That's about $3 at the private hospital. Of course, in a government facility, it would have been free. So there are the costs in India: $3 at a private hospital or free in a government facility. So I think that photo is probably worth $3. It's a great picture of both of you. Thank you for that, ladies. What else have we got? Oh yeah, that's the age 45 can get the vaccine from the 1st of April in India. So that's being broadly rolled out. This is Susanna waiting for her vaccine. Looks very well organised. Waiting area. Yeah, all looking good. Other clinics are available, of course, but no, seriously, it's looking good and well organised, and that's excellent. So thank you for that, Susanna from India. Now, the last pictures I want to show you today are from bit of a health warning on this one, I'm afraid. Some of you might find this unpleasant. Not this, of course. This is Misty, who's making masks and gives them away to her friends for free, and she's also watching. So that is a lovely picture, Misty. Thank you. This is the one I was more concerned about. So Misty's kind of put me on some masks, but they're being given away free. They prevent the spread of disease, so it's good. So we've got some of the sayings here: open the windows, coughs and sneezes spread diseases. Masks are critical, not political. 6 feet distance to maintain our existence. Yep. Coughs and sneezes spread diseases. Yep. Remember all of those. So I must say, quite an impressive piece of design. I wouldn't know how to do that. So I just thought that was great. But anyone that makes masks and gives them away free is good in my book. So thank you for that, Misty, and hope that update from Brazil was useful. It really does. I found it really helpful to clarify. You know, as the story comes out, you kind of get bits and bobs, and Raphael gave a really good summary there, which is based on his experience in the country. So thank you for that. And I think that is us for this video. So thank you for watching.